Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We're your hosts, Dr. Jamie Erwin, board-certified OBGYN, and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counseling. Let's begin the journey. Yes, I love the midweek break. It's just so lovely when you get to Wednesday. Just take a breath.
Yes.
Turn on the podcast.
Put your pink on with a little green because it's St. Patty's Day.
Yeah. Spring is one of my favorite times of year, for sure.
As it should be.
Yeah.
Birthday.
My birthday's coming up.
Mm-hmm.
It's a big one. 45.
Yes, that is a big one.
I move up in the age range as far as running, you know.
So now you'll be at the bottom.
So it's 45 to 49.
There you go.
But it means not that I'm anywhere close to, like qualifying for Boston Marathon or anything, but I'm closer.
Yeah, you are.
Because I'm older.
Never know. Yes.
Yeah. So, as you age, you can be a little slower.
Mm-hmm.
So, yeah, someday,
It's exciting.
I've really tried to stop saying never, because there was a time in my life where I told myself a story. I could never do a marathon. And now I've done 5.
Now you're doing it.
And, about the podcast too.
Yes.
I could never do a podcast.
Mm-hmm.
Look at us.
Look at us. We're doing it. We're figuring it out.
Yeah. We're going to keep it rolling.
We are. I'm so excited today because we're going to talk about a really fun topic that I love telling people, that my friend delivered a gorilla, and they always give me the strangest looks. So I'm really excited for this to be our topic today.
Yes. Mm-hmm. It's something people want to hear about.
They do.
Strangely enough.
Uh-huh.
They want to hear the gorilla story.
The gorilla story. So just tell us. First of all, let's just start at the beginning. How did this start? How did it come to be that they called you in this situation?
All right. So if you don't know, because you're not a Fort Worth native, or maybe you just are new to the podcast,
yes.
new to us, Dr. Erwin, Dr. Mary Catherine Nader.
Yep. We're glad you're here.
I'm an OBGYN, and I deliver, one of the things I do is I deliver human babies. But in January of 2023, I had the distinct honor of doing a C-section on a lowland gorilla who had severe preeclampsia and needed delivery somewhat urgently.
So explain preeclampsia.
Yes. Okay. Well, back to your first question.
Yes.
How did this all come to be?
Start?
How did this start? People just want to know, how in the world? Have you ever done this before? Why did they call you? How did they get your name? So we are very blessed to be in Fort Worth and have one of the most amazing zoos in the country, in the world.
Yes.
It is truly outstanding. And I have to shout out all of the people who work at the zoo in the veterinary medicine department, the vets, the technicians, the caregivers for all the animals, but especially the primates. They are incredible people who know their animals in and out. I mean, it's spectacular. It's truly remarkable. So what a lot of people don't know is that I'm assuming most zoos across the world, but definitely the Fort Worth Zoo, has a short list of people that they can phone a friend. Specialists, doctors in the human world that can help them out, especially when it comes to their primates. Because we know that primates and we're primates, right? So like the gorillas and humans, we're very similar in our physiology and our anatomy. So back in, I think 2018, I could be wrong, 2016, 17, 18, somewhere around there, one of my colleagues retired. And he was preparing for his retirement, tying up loose ends, taking care of all his commitments. He had had a long career as an OBGYN here in Fort Worth. And he called me one day and said, Jamie, I don't know if you know this, but I have been a consultant for the Fort Worth Zoo for this number of years. And I'm retiring, and I was wondering if you would be interested in taking over this role.
Wow.
And I didn't know what to say. I wanted to know more. Like, what does this entail? Like, this is not something I've ever even considered. I didn't know that was a thing.
Yeah.
And so he said, well, they may email you or call you and have some questions here and there over the years. But yeah, it's great. The people are great. They're fascinating. They're really kind and curious. And it's been a lot of fun. So I said, sure. Sign me up. Okay. So my first interaction was via email. The veterinarian at the time emailed me asking if he could ask me some questions about a orangutan that they were wanting to acquire from Europe.
Wow.
Yeah. I mean, I've learned so much, just how animals move from zoo to zoo, how that works, who actually kind of has ownership of the animal. The animal may be at one zoo, but actually someone else has proprietorship over them. And it's very it's fascinating.
Yes.
It's a whole nother world, right? So, so they were doing an evaluation, a medical evaluation of this female orangutan. That's how you say it, by the way. It's not orangutan.
Okay.
I've also learned this. So
that's good to know.
And she had an ovarian cyst that they identified. And so he sent me the ultrasound images and the report and wanted my take on, did I think this was cancerous? Did I think it would affect her fertility, et cetera, et cetera? And I mean, really, I just had to look at the data and tell him what I would do if this were a human patient. And so that's what I did. And so, I mean, it was really straightforward, easy job. It just happened to not be a human patient, but another primate. So then fast forward, and the Fort Worth Zoo has a lovely female lowland gorilla named Gracie. So Gracie, they bred to Elmo, who is the silverback of the troop at the Fort Worth Zoo. And Gracie, this was, I'm forgetting my dates, but this was her first pregnancy. And there were 2 potential conception dates where she and Elmo got together, and they weren't exactly sure which conception date she actually conceived. And so they brought me in to the zoo, and they had trained Gracie to come up and present her abdomen to the enclosure.
Oh my goodness.
And they would reward her with squirting some juice into her mouth or giving her a snack. And they had a very small ultrasound probe that they could then, as she was presenting her abdomen up to the enclosure, put through this little, like, small, tiny opening and attempt an ultrasound. And so they were wanting to know, like, when did I think she was going to deliver? So their gestational age is 36 weeks, whereas a human is 40 weeks.
Okay.
So I had no idea. I mean,
What were you thinking going in? Well, I just want to know what you were thinking.
Well, I'll tell you what my husband was thinking. Charlie had concerns. Charlie was like, are you going to be in the enclosure with her? Like, he was very concerned for my safety. I was like, no. She's on one side, I'm on the other. It's going to be fine. But yeah, I mean, I've never been that close to a gorilla before. They are... I was intimidated, to say the least.
Right.
So,
did you come in like a special entrance?
Oh yeah, yeah. This is all like behind the scenes, which was also super cool to get to go behind the scenes at the zoo. Amazing.
Growing up, going to the zoo. I mean, our whole lives, and I'm thinking of like even student council, volunteering, boo at the zoo, all the things. Like, how cool!
This is behind the scenes, major. So yeah, I attempted a sonogram on Gracie. It was like, you could have put that thing on it. I did. I knew something was moving inside of her. Okay. I could not get any idea of how far along she was.
Sure.
Her hair. It's also hair. It's not fur.
Okay,
it's hair. These are important things in the primate world. Okay.
And anyway. Is it the same machine that we would use?
Kinda. Okay. Like the probe had to be so much smaller to fit through the space. Gotcha. I couldn't tell. Okay. I mean, I'll be honest with you. Right. I couldn't tell. There was a baby in there. That's all I saw.
There you go.
That's it. Okay, so fast forward, I was kind of on standby for Gracie.
Sure. Just because
I was the consultant.
Okay.
She had never delivered before.
Okay.
Turns out Gracie did fine. She delivered her first. They named that baby, I'm blanking now. There's It was Gus. So baby Gus.
Yes, I remember. He was
so Gus
cute.
is still there. He's so cute. He's kind of an adolescent now. So she delivered Gus, no problem. She then went on to get pregnant and delivered Bruno, no problem. I don't even think they called me about Bruno.
Okay.
I think it was like I heard the announcement. I didn't even know she was pregnant, kind of thing.
Yeah.
So she did fine. So then different mama, Sakani.
Okay.
All right. So Sakani is our patient of interest. Sakani is a bit older than Gracie was. Gracie was very young when she delivered her babies, but Sakani was older, like 32, I think, which, it's not terribly old. Their lifespan is about similar to humans.
Really?
So gorillas can live at least in captivity into their 70s.
Wow.
So I believe the Fort Worth Zoo has the oldest living gorilla in captivity, and that's Ramses. He's not out in the public, but he's behind the scenes, just living his best life, just kind of eating and sleeping like an old man. And anyway, so they can live into their 70s, but 32, while not advanced maternal age, is still a bit older. So Sakani conceived also by Elmo, is a silverback. So Elmo is the dad. And I remember this was right after New Year. So I had just finished my last holiday shift working at the hospital, and we actually went up to Colorado for winter break. And I got an email from the vet saying that they had a gorilla they wanted to discuss with me, that she was due in February, and they had some questions and some concerns. Could we talk on the phone? So emailed back, set up a phone call, and we chatted. And they were concerned because Sakani was 32 weeks pregnant, I believe, so about a month early, and was starting to have some behavioral changes that had her caregivers very concerned. She was holding her head and moving, kind of shaking her head up and down while holding her head. And that was very different. She had never done that before. Additionally, she had some teeth chattering, which can be a sign that they're in distress or having pain.
Yeah.
And so their concern was that she was developing a headache, that she was exhibiting outward signs of a neurological symptom that is a severe headache. Well, in a pregnancy and in primates, a severe headache later in the gestation, so towards the end of pregnancy, is a warning sign for preeclampsia. Preeclampsia is a hypertensive disorder that only occurs in pregnancy. And what is happening at the root cause is that the blood vessels all over the female's body are constricting intermittently. So we call that vasoconstriction, and it's just the blood vessels squeezing and relaxing intermittently. And when this happens in the brain, it can cause a headache. When it happens in the liver, it can cause liver dysfunction. When it happens in the arteries and veins in the eyes, the retina, it can cause vision changes. Kidneys can cause kidney dysfunction. When the kidneys dysfunction, their sole job is to filter out the blood and create urine. And so when the kidneys are not working well at their filtering job, they start letting protein show up in the urine. So that is how we diagnose preeclampsia, as we measure how much protein is in the urine, and if it's high levels, we know that is what's happening, the process. So during our phone call, I asked the veterinarian, what test can we do? Because in humans, we would have them collect all their urine for 24 hours and draw their blood, looking at liver function, kidney function, and their blood levels. As the liver dysfunctions, that can cause platelet numbers to go down, which can cause life-threatening hemorrhage. So it's a very serious situation, and the cure is delivery, but if left untreated, it progresses to where there can be stillbirth, because the placenta can also have this vasoconstriction process, cutting off the blood supply, limiting the blood supply to the baby. The mother can have a stroke, a seizure. I mean, there can be very life-threatening, severe repercussions. So I didn't know, like, can you draw a gorilla's blood? I have no idea. And she said that there are actually some gorillas out there who have been trained to present for a venipuncture to get their blood drawn. Sakani is not one of them. Sakani has some attitude. She's a bit feisty. It's fascinating. These gorillas have such personality, similar to humans. Right. We just all are different. But they were able to collect a urine sample from her and test the protein, not a full 24-hour collection, but just a sample, and do a spot check of how much protein. And she had a significantly high amount of protein.
Wow, okay.
So given that we now had a severe headache, presumably, and high amounts of protein, we couldn't take her blood pressure, but we had to make an assumption that this was, in fact, severe preeclampsia and that we needed to cure her. And that meant we needed to deliver her, and we couldn't wait for her to go into labor because that could have been 4 more weeks. And if we waited, we could lose the baby, we could lose the mom, we could lose both.
Right.
So.
And this is happening while you're in Colorado.
I'm in Colorado still. Yeah. With, the family and we're still having a great time, sure. Honestly. Like I'm figuring this out and, be like, I got to go take a phone call. And I told Charlie what was happening. We didn't tell the kids what was happening, but yes. So kind of sorting through this. And so that was a phone call like, okay, can we get these tests? Can you get the urine? And so then the next day they'd call me back and have the results.
Mm-hmm. And all this time you're thinking, okay, what am I going to do here? This is interesting.
Yeah. How's this going to play out? Like, wow. I think I know where we're heading here. Like this, I think definitely there was this kind of second guessing, like, am I going to be the one that really encourages this vet to like pull the trigger on this? Like, I know what we need to do. I have to just really encourage her to ultimately she was the one making that decision, right. But with my guidance. So you just have to stick in those moments. I think you just have to stick with what you know and not second guess yourself. So we have that conversation. She needs to be delivered. We need to do a C-section because an induction of labor in the gorilla has not, we weren't willing to risk that, right? Like totally uncharted territory. And a cesarean was a more controlled situation because this baby is early. Is this baby going to survive? How much will the baby weigh? What will the needs of the baby be this premature? So another little fun fact here. I've already mentioned how difficult it is to do a sono on a gorilla. The vets and the vet students and the vet techs had attempted a sono on Sakani, and there was a chance that there were twins.
Oh my goodness.
They weren't sure. It's so difficult.
Sure.
They weren't sure what they were seeing, and there was one image that they showed to me that they thought, are there two? Now, a twin gestation is another risk factor for preeclampsia. So older age, really young age are risk factors, but multiple gestations is another risk factor for developing preeclampsia. Another risk factor is having underlying hypertension or chronic hypertension. You're more at risk of developing superimposed preeclampsia, which is worsening of your blood pressure, and then those signs and symptoms I've mentioned.
Yeah, wow.
So that's part of this conversation as well. There may be twins. We really don't want to induce a labor for twins. How would you even do that? I don't know in a gorilla. So for multiple factors, a C-section was, in fact, the best next step. Mm-hmm. So then it was rallying the troops. How do we do this? How do we make this happen? We need personnel. We need the equipment. We need all the things. And it's never been done before at the Fort Worth Zoo. There are other zoos who have performed a C-section on a gorilla. I know there was one in the Northeast. That gorilla had something called placenta previa, where the placenta had implanted so that it was covering the cervix, which is the exit route. And so, and I believe she had bleeding, which led to that diagnosis via ultrasound. And so the baby can't exit vaginally and go through and through the placenta. So they had to do a C-section on that mama gorilla as well. So it has been done.
Okay.
Never in Fort Worth.
Right. And veterinarians are not trained in doing a cesarean, I'm guessing?
Well, no, they may have seen some, perhaps, and maybe on other animals, but because it's so rare, our vets at the Fort Worth Zoo sure hadn't seen one or done one.
Right.
But an OBGYN in the human world, I mean, I've done thousands.
Thousands.
It's the most common surgery I do, and I've been doing this for 17 years. So literally thousands and thousands of C-sections.
Mm-hmm.
So she asks me if I can bring some helpers, a neonatologist, because we're going to have a preterm infant, maybe two. I'm going to need a surgical assistant. I'm going to need equipment. I'm going to need, we're going to need some things. Oh, and by the way, this is top secret confidential. You cannot tell anybody about this. They really, really kept the lid on this because we didn't know how this was going to go.
Sure.
I mean, this, if it had gone south,
bad.
it could have been bad, like tragedy, right? And so we wanted to just protect the privacy of the animals in the zoo and really keep a lid on this and hope for the best. So that was tricky. I had to really kind of think about who am I going to get involved? Who can I trust? Who will show up for this crazy experience? And it was really a delight to just get to call on some of my colleagues. So fabulous neonatologist, Dr. Robert Ersprung, just have utmost respect. He has the best bedside manner, incredible. The anesthesiologist I called first actually had to do a 24-hour shift that day that we were planning. So we were, planning for the next day. But he recommended, and I agreed, that a fabulous anesthesia provider, Dennis Occhiogrosso, he was absolutely incredible, tons of experience, so knowledgeable, so kind. And then I had my surgical assistant, Andrew Coates. He and I have done hundreds and hundreds C-sections, hysterectomies. He's the assistant that I've operated with probably the most. And our hospital was generous enough to donate a C-section tray. So all of the equipment, they were like, and we don't want it back.
In case you're wondering.
In case you're wondering. You were not having equipment used on you that was also used on the gorillas. So yeah, that was very generous that they made that donation. So rallied the troops, called him up and was like, this is not a joke. I am not kidding you. This is legit happening. I just felt like it was like a Mission Impossible episode.
Like yes.
All right, we're going to meet here, be at the zoo, 12 o'clock. We're going to huddle and then this is the process. So that was a really fun part, just calling and explaining my need and would you help me, and this is going to be amazing. So
this was all volunteer, right?
Oh yeah. So I was still on vacation. It's not like I was still off work. I was already off. So
and you're doing this from Colorado, calling people saying,
yes.
Hey, okay, I'm coming home. I need you to meet me at the zoo.
Yeah. What are you doing tomorrow? Can you change those plans and meet me at the zoo? So ended up changing our flight, got us on an earlier flight. We were flying home that day anyway, but just got us home earlier. And we went home and then got my scrubs on, and Charlie was like, once again, he's like, be careful. Are you going to be alone with her in the enclosure? I was like, absolutely not. Like, I have so many people helping me, and I was also intentional in choosing some very large men to be there to, the CRNA, the certified registered nurse anesthetist, he's big, strong like bull. So he was there and making sure she stayed asleep. And then the surgical assistant's also a big, strong CrossFit guy. And anyway, I knew I was going to be in good hands and everybody was going to be working together for the best outcome for everybody. So we get to the zoo everybody's there. We have our neonatologist, our anesthesia, our surgical assistant. We've got all the equipment. And the zoo has a whole hospital, which is impressive. So we have a meeting. So the head veterinarian and everybody gets name tags. We all have surgical scrub caps on. We put with masking tape our names. We all have to be in N95s because gorillas can contract COVID and other respiratory diseases and vice versa. They can give us stuff. We can give them flu and colds and COVID. So we wanted, to protect them and protect ourselves. So everybody's in N95s. And we really have this great huddle step by step of like, what's the plan going to be and who's going to do what. And so that way everybody's roles and tasks were very outlined to stay safe and to take care of Sakani and the baby. And so this is a Friday, like the zoo is open. It's the middle of the day. There's people walking around the zoo, and we load up in these like white vans, zoo vans, and we leave the back entrance and we go to the primate world back entrance, and they kind of block things off. We have zoo security on their bicycles, and they block off the path so people can't be kind of walking through as we're going in and coming out. And so we go in the back entrance, and Sakani is there in her enclosure. And probably the most stressful part for the zoo vet was administering the anesthetic for Sakani to go down in her enclosure. And so that was with like a blow dart situation. Sure. I don't know. She was feeling the pressure. Sakani was so smart that there was a risk that she would get the medicine in her and then like take out before it was fully injected, because she was just smart and like throw it down, and like we wouldn't be able to get her down and anesthetized. So thankfully, Dr. Canezo is incredible. She's so brave and talented, and was able to do that. So Sakani, and also like she could play possum, so she could be down and like not really be down, and then you go in. So I was way in the back for all of this, but she got her anesthetic, and they confirmed she was asleep, and then they were able to transport her into kind of a holding area there in the enclosure, kind of a small makeshift little exam room. And that's where she was intubated. So she secured her airway there. It was incredible just seeing them, separate her jaws and just her huge canines and just this powerful animal. And so the CRNA was able to just easily intubate her, and I was just totally in awe of his skills. So she's asleep. They were able to get IV lines on her. All of the zoo personnel were working on her, getting IV lines access secured, her airway secured. And now it's time to load her up back into the van and get her to the hospital. And so efforts were definitely made to try to get the zoo guests away from the exit so we could safely, so she's on a gurney at this point. And so we're rolling her on the gurney, loading her into the van. And so I get on the van with her. She's asleep, and I'm in a van with a gorilla who's asleep. I was just like, what is my life? Oh my gosh. So it's a very short trip to the hospital. And the next step was unloading her, and before we went into the operating room, placed her on another kind of examination table at the hospital. So way more space.
This is the zoo hospital.
This is at the zoo. Yes, let me be clear. That was another question that came up. Like, did you do this like at the hospital? I was like, no.
The zoo hospital.
The legal team would not have that at the hospital where I work at. So absolutely not. The zoo hospital. So they took the opportunity while she was anesthetized to do routine screenings. I don't know what all they were doing, but like dental checks and testing and kind of like her well woman. They did her well woman at the time.
They did her well woman.
Yeah.
There they go.
And we started to prep her for surgery. So we trimmed her hair on her abdomen so that we would be able to make the incision, and placed her Foley catheter. I did that part. So that her perineum was very similar to a human as far as her anatomy, and was able to place the Foley catheter in her urethra to drain her bladder, which we routinely do that in all of our C-sections. We want the bladder nice and small and deflated to avoid injury during a C-section. And so once they had all their testing done, once she was prepped, we then moved her once more into the operating room. And that was a separate space, so in order to keep it as sterile as possible. And we prepped her and draped her for surgery. So I think at that point, I just really had this autopilot moment. And it was truly just routine. I mean, it really was just the same way. Some people have asked, well, how did you study for this? Like, did you get like a gorilla anatomy book? Like, how did you know what to do? And my answer is, I just did what I always do. I felt like her pelvis was a bit more narrow than a human pelvis as far as like how much space was there for us to work in. I also think that the preeclampsia had caused some growth restriction of the baby, which is another sequelae of preeclampsia, because the baby was very small. So she was 32 weeks. The full gestation is 36 weeks, but the baby came out looking more to me like a kind of a 28-weeker of a human. And I think that was just a cause, because of the preeclampsia. So the steps were the same. There was one kind of case study that was written up in a veterinary journal about operating on gorillas. And they noted that gorillas tend to have more adhesions, so some scarring in the pelvis, whether that be from pelvic inflammatory disease, like maybe they get STDs and they go untreated, and that can cause some scarring. And so we were ready for that because we had found that article. But it was very minimal. Like there was kind of a bowel adhesion that we just easily took down, and then we were able to access her uterus. We made a low transverse incision on the uterus, which is the most common type of incision on a human. The baby was in the vertex presentation, so it was head down, and so we were able to elevate and deliver the baby. And at first, the baby really didn't do anything because this whole time, the mom had been under general anesthesia, so had been completely asleep, sedated, and all of that same medicine was circulating to the baby. And in the human world, we use epidurals. And we use something called combined spinal epidurals, which is just a different form of regional anesthesia where the mom is awake for her C-section, but she's numb pretty much from the waist down, doesn't feel the pain, but can feel the movement, can feel the pressure, but not the pain. So obviously we're not keeping a gorilla awake while we are cutting her open. Right. So as a result, the baby was delivered and was very, very sleepy, sedated, not showing really any signs of life. And we clamped and cut the cord, just like we always do, and handed the baby. And I could not tell the gender. I was trying, like, oh, that is different. Like, things are tucked in there or whatever. I was like, I'm not sure what I'm looking at down there. But handed the baby off. And then they had a kind of a resuscitation area, kind of just like a NICU does, a neonatology ICU, in that adjacent room at the zoo hospital. So we just got to work closing her up, and we did that in the exact same fashion that we do for humans. The only difference, we used a different suture for her skin closure because unlike humans, we weren't going to be able to counsel Sakani to take it easy, to not climb her enclosure, to not be active. She was going to go back to gorilla life as usual. And so we really wanted to do everything we could to be sure her incision stayed intact and didn't come open, didn't get infected. So we used kind of a longer acting delayed absorbable suture that would just stick around longer to ensure her incision stayed closed. The vets had some really cool tricks up their sleeves to prevent her from kind of picking at it or messing it or any of the other gorillas coming over and messing with it. So they got a stick of deodorant.
Oh, wow.
And put that all around it so that if someone tried to come up and like lick her incision, it would taste bad. And then while she was asleep, they painted her fingernails in hopes that she would be fascinated with her fingernails and not tempted to pick at her incision. Because we couldn't put a bandage on it. You can't do anything. It's not, they're not going to keep that on. And then just the whole process in reverse. So loaded her back on the gurney, back on the van, back to her enclosure, and then, they were able to reverse her anesthetic, and she was able to wake up and then extubate her. They wanted to time that. That was another critical piece. They wanted her to be asleep while they were there with her in the enclosure, putting her back, but didn't want her so sleepy that she couldn't protect her airway when it was time to extubate her. So very much a timing to keep her safe. And it went so well. I mean, it was just absolutely incredible. So by the time we got back from returning Sakani to her enclosure, the baby was finally starting to wake up. We've got some great pictures of, she's in kind of a little incubator. She's got little nasal prongs of oxygen going. And it was just so fun seeing her come to life when the anesthesia finally exited her system. Just sweet baby noises and a really strong hand grip. Just, I got to hold her again. I mean, of course I got to hold her as soon as she came out, but have a great photo that ended up making the cover of a lot of newspapers and really went viral. Even BBC picked up the story, and it was just
a big deal. It was a really big deal.
It's such a heartwarming story, just I think human doctors coming together for a different species, the skill set crossing over, just getting to use my knowledge in a situation I never even dreamed of was incredible. Truly.
Yeah, it is. It's an incredible story. It's amazing. What an awesome experience.
Yeah.
Mm-hmm. What do you think was the part that stands out to you when you think about it?
I think, well, one part that really touched me is when we finally did have the press conference, which was about 6 weeks later.
They wanted to wait and make sure.
Yes. So still, like, we do this great thing. It was amazing. Baby's doing well, thriving. We have all reasons to expect it's going to be a great outcome. And you cannot tell anybody. That was so hard. I mean, it was, and this is like January, and I'm like, man, what's next? What else is there? Like, I feel like I can retire. Like, I don't know how to top this. Nothing is going to top this. This whole rest of the year is just going to be kind of a letdown. No, I mean, not really. But it really, truly was this apex moment of like, wow, we just did such a freaking cool thing. So 6 weeks, the baby just really comes alive and is thriving and growing and meeting milestones and gaining weight and just doing so well. They had to do around-the-clock care for her because she was premature. She needed frequent feedings. The mom had to recover from her surgery. And so truly a neonatal ICU up at the Fort Worth Zoo all this time, and nobody even knows it out in the public that there's a baby gorilla that's been born. So the press conference was held on Valentine's Day that year, 2023. And I remember showing up for that, and they've got the veterinarians and the caregivers and the technicians. Everybody's there. Media's there. It's packed. We've got tons of people. Super fun. And we're kind of in the back room preparing. And I remember saying, like, well, have y'all thought of a name? And everyone just kind of like looked at each other and nobody answered me. And I was like, okay. And they're like, well, we're going to announce it at the press conference. It's a surprise. So we do the press conference. And then the very last question was, what's the baby's name? And they named the baby Jamila, which is partly Jamie, my name. So they used part of my name. And that was one of the most meaningful moments of my life. I started crying. It just was so touching. And in Swahili, it means beautiful. And they just appreciated my contribution. And now I have a gorilla named after me.
There you go. Mark that off the list.
Definitely something I never, ever, ever thought would happen.
And Jamila is not at the Fort Worth Zoo anymore.
That's correct. So she continued to grow and do amazing. And then when the time came that she was able to be reintroduced to her mom and to the troop, unfortunately, because of that separation, that extended separation, Sakani did not show signs or interest in mothering, which is sad.
Yeah.
There were attempted efforts for Gracie. I mentioned Gracie earlier. She's got Bruno and Gus, but Gracie did not show interest in being a surrogate, nor did Winifred, who's another female at the zoo. Winifred doesn't have any children, but they really made this effort to see if Jamila could stay. But ultimately, they found an amazing surrogate up at the Cleveland Zoo who is named Frederica, who is 50 years old. She's older now. I guess she's like 51, maybe 52. But Frederica is a proven surrogate. She has done this before, adopting in, taking in another gorilla's baby, nursing it, raising it as her own. And so, yeah, that's where Jamila is. She's in Cleveland, living her best life with her new family. And the hope is that someday she will come back home to Fort Worth, perhaps when her dad is not the silverback. So I hope so. I hope she comes home. I would love to have her here in Fort Worth and, you know, maybe take my grandchildren someday to see Jamila, who I helped bring into the world.
Yeah. Wow. That is such an amazing story. What an incredible experience that you probably never thought you'd have going through med school.
Never. A colleague, shortly after the press conference, we were talking for a different reason, but he said, Jamie, just imagine you're an old lady in your 80s and you've got your grandchildren and great-grandchildren around you, and you say, let me tell you about the time that I delivered a baby gorilla. And I mean, I had not thought about that. But it truly is something I'm going to be able to take with me for my whole life, which is really fun. So patients love talking about it. They love coming in. Still, like, there's not a week that goes by that someone doesn't mention the gorilla, which is so fun. I have a little gorilla, kind of little logo-looking thing that a medical student, one of my precious medical students, got for me. It's kind of wooden, like a keychain kind of, and it goes on my ID badge. So it's always there. I still just have a bit of Sakani and Jamila with me every day.
I love that. Thank you so much for sharing it with us. What a great story, and just such a fun story, and such a good Fort Worth story too. Something about our amazing Fort Worth Zoo and just that partnership. That's so awesome that you're able to use your gifts in that way. So proud of you. I remember seeing it and just being like, that's my friend. I think you told me a little bit early, and I was like, yay. Of course, I'm good at keeping things to myself.
Yeah,
so
you are. You're a safe
place. I was
place.
very proud, very proud, and couldn't wait to brag on you. And
Thank
still
you.
like to brag on you.
Yeah,
So, good
it's
job.
a lot of fun, you know, and I think at the end of the day, you just don't ever know what is going to come
That's right.
along. And I just encourage our listeners to just be faithful. This wasn't something I was looking for. I just was doing what I do. And, you know, there's days it can be a grind, day in and day out, and you just keep plugging away, being faithful to the job. And sometimes doors open that you never dreamed of.
Mm-hmm.
And this is an example of that.
Yeah, that is. That's awesome. Thank you for sharing it with us.
My pleasure.
Yeah. Thank you for joining us. This was another episode of A Journey to Whole Woman Health. We're so glad that you are here. We hope that you'll share this with friends and family and anybody else who's wondering, and somebody in Fort Worth delivered a gorilla? So feel free to share this, and we hope that you'll come back and spend next Wednesday with us.
See you then. This episode, we'd like to highlight the Archway, formerly known as Safe Haven. The Archway provides a way forward for survivors of intimate partner violence and builds stronger systems to prevent domestic violence and protect lives. Check them out, The Archway.
Thank you for joining us on A Journey to Whole Woman Health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. This podcast is for educational and informational purposes only and is not intended as medical, mental health, or professional advice. The information shared on A Journey to Whole Woman Health is not a substitute for individualized care, diagnosis, or treatment from your own physician, mental health provider, or qualified healthcare professional. Always seek the advice of your personal healthcare provider regarding any medical or mental health concerns. Never disregard a delay seeking professional care because of something you heard in this podcast.